People who are 65 and older pretty much been the most impacted throughout this pandemic. Now the most vulnerable age group is being prioritized to receive the COVID-19 vaccine.
So seniors can now start making appointments across our area. Joining us live to discuss the importance of safety and the safety of getting vaccinated is primary care physician Dr. Kyle Vincent. Doctor, thanks so much for being here with us. We appreciate it this morning.
Absolutely. Thank you for having me.
So let's talk about the importance of getting seniors vaccinated first. We've been talking about this all along, but we didn't know that they were going to actually jump the line right after healthcare workers. Why was that decision made, do you think?
Absolutely. Essentially, it's the same reason and protocol as to why healthcare workers, primary care physicians, hospitalists, nurses, they got theirs first, is because the risk of contracting it and also being most affected by it, just based on the number, they're most at risk. Those over 65, whether they have high blood pressure or diabetes or other these comorbid conditions, we want them to be able to have their immune system boosted, very similar to the pneumonia vaccine that we recommend for seniors, for folks over 65, to better prepare for a potential infection.
But it's the people who are 65 and older, they have a much greater chance of potentially dying from COVID-19 as opposed to what would you describe as the average healthcare worker, right?
Absolutely. Absolutely. Yes. They are more at risk simply based on their age and where their immune system is and being able to combat coronavirus. That's the reason why they are jumping the line and wanting to get the vaccines first.
So my mom is 90, so we just got her vaccinated. But when you make the appointment, you don't know if you're getting Moderna or Pfizer. Is it the same? Should anybody be concerned about that?
Right. They are the same. The main difference is the way that they are stored. There's some refrigeration requirements as far as getting them transported, which is why some facilities have the Moderna versus the Pfizer vaccine, but they are both the same efficacy as far as what they are doing to elicit a good immune response. They're both 2 doses. One is a 3-week window of the Pfizer, and then the Moderna, you wait 4 weeks to get the second dose.
Can you talk about some of the symptoms that any of your patients 65 and older have experienced since getting the shot?
So the general symptoms, the most common one rather, is just a little bit of some arm soreness, and that's something to be expected having an injection that's intramuscularly. Some after the second dose might have gotten just a little bit of some chills that lasted less than a day. And outside of that, those are the most common vaccines. You know, when you do get the vaccine, I received mine, you are able to go on the website to document your symptoms to kind of so everybody can get a good amount of information and log in on what symptoms people are experiencing. But outside of the arm soreness and maybe a little bit of some chills after that second dose, those are the most common ones, and they're very short-lived as far as the length of time to experience those.
So, doctor, a lot of people are wondering if you already had COVID, if you tested positive, you've recovered, should you still get vaccinated, and if so, when?
Yes, I would recommend that you still get vaccinated. I would recommend about a 3-month, 90-day period between you your symptoms resolving from being infected with coronavirus to getting the vaccine.
And so let's talk about the percentages of what happens after you get the first dose, because there's 2 doses. So after someone 65 and older, let's say they get the first shot, they shouldn't go out and travel to Miami and take their mask off. They should still take the precautions because you need that second dose to make it that much more effective, right?
Correct. Absolutely. Yes, you really do want to get both doses in. And even after you get both doses, because this is a public health issue and it is, we're still rolling it out. And yes, folks over 65 are getting the vaccine now. That means folks under 65 have not yet. So the ability to spread and still become infected, you still would want to adhere to all of the public safety guidelines of wearing a mask and washing hands just for the safety of others, in addition to making sure you get both of those doses before you start traveling and doing a lot of things like that.
So we are seeing these vaccination super pods being set up. We've seen them in Orange County. What are the future public health benefits of these widespread vaccinations? Even, Dodger Stadium, we're seeing thousands and thousands of people going to one place to get vaccinated. What do you think of that?
I think it's a great way to do it. I think logistically it's been, we've had to kind of roll with the punches, so to speak, as far as how to actually execute and getting folks vaccinated. I think these super centers are really important because it's one location and those people that are in charge there can really have logistics set up to really vaccinate a lot of people in a short amount of time. That gives us our best chance to get as many people vaccinated in the shortest amount of time period, in which case we will start to have percentages of more vaccinated than not. And therein lies the real solution to the issue as far as coronavirus spreading, and then obviously people subsequently succumbing to being infected by it.
Are you seeing any resistance from people 65 and older from getting this vaccine? I personally really haven't. I think people are excited and they're ready to line up. They want this shot, or these shots, so to say. Are you seeing any people who are resistant right now?
There are some questions. There's some questions about the speed in which the vaccine was produced and the red tape, or where it's the FDA or some of the trials that were done to produce the vaccine. But once I have a conversation with my patients as far as the safety of it all, which it is very safe, and then obviously the efficacy of it as far as what it actually does, they're perfectly okay with getting the vaccine. It's one of those things that I think people want a solution. We want to get back to our normal lives, and this is a very, very big way and big step in accomplishing that.
Dr. Vincent, thank you so much for being here. We really appreciate it. You can learn more about Dr. Kyle Vincent and his new practice in Temecula by visiting drkylevincent.com. You can also follow him at social media at Dr. Kyle Vincent. Thanks again. We'll be right back.